Hey guys! Oh wait, where's the camera? It's right there. It's right there. You gotta look at that guy. Hi guys, how you guys doing? It's Dr. Kyle here again. I have a super duper special episode for y'all today because I'm with my cousin Zoe. Say what's up, Zoe.
What's up? Hi guys, my name is Zoe. I'm 13 years old and I'm a second degree black belt in Taekwondo. Taekwondo is a martial arts from South Korea and they focus more on kicks rather than punches. So I've had an ankle injury myself before and I want to show you how to treat it since we're all at home at the moment.
So that's exactly what we're going to be talking about today, is how to bulletproof your ankle. We have a simple acronym so you guys can remember it. It's called PRICE. So P-R-I-C-E. Each letter corresponds to each activity that you're going to be doing. Trust me, it's going to be super easy. So Zoe will go over each and every one of those letters. And by the way, guys, this specifically is just for minor sprains and strains. So make sure you check with your physical therapist first before you do any of these activities that we're recommending for you. A sprain is basically when you injure your ligament. Your ligament is a structure in your body that connects bone to bone, and that mostly happens when you turn your foot inward like this, which happens most of the time.
So PRICE stands for first pain medication and protection. R stands for rest. I is for ice. C is for compression. And lastly, E is for elevation. So first P, protection, pain medication. Pain medication will reduce inflammation and reduce pain. And you can take like Motrin or Tylenol. But if you want to buy off-brands from your local drugstore, that's also alright. You don't want to depend on these medicines, so just take as needed.
Protection is very important because you want to be able to protect the wound as much as you can. If your physical therapist recommends putting a brace or a boot, then I would follow that because you want to be able to avoid activities that stresses your ankle. Moving on to the next letter.
R. So R is for rest, right? And you want to rest your injured area for at least 3 weeks, and that will allow the ankle to heal completely, so you don't feel any more pain. And all people are different, so usually 3 weeks would be like an estimate, but again, it's different for everyone, so just take your time through it and don't rush.
Yep. It's exactly what you said, guys. Make sure you rest, have adequate amount of rest, and you want to be able to give your wound adequate amounts of time to heal itself. All right, next letter.
I. So ice. Ice again will reduce inflammation and swelling. It can take away pain too, and you want to ice your ankle for 15 to 20 minutes throughout the day. And you can use like a belt or a shirt to hold the ice onto your foot.
Yeah, what Zoe said, make sure you ice your injured area at least 15 to 20 minutes. And don't worry, we'll put contraindications and things to be careful with when you use ice. Because you also don't want to hurt yourself when you use ice, right? Ice is definitely to reduce swelling, it reduces inflammation, and it reduces pain as well. I would recommend it using 15 to 20 minutes throughout the day, 3 times a day, even as much as, just make sure you use it throughout the day. All right, so next letter.
C.
C.
So you want to use like a brace or again a belt or shirt to compress your ankle. So it doesn't move as much, but also to have blood flow go back into your body.
You want to bring the fluid back to your heart. I would recommend using an ACE bandage wrap. This is how you do it. So I'm gonna show you how to wrap your ankle using an ACE wrap. ACE wraps come in different sizes. They range from 2, 3, 4 inches to about 6 inches. This is a 4-inch ACE wrap, and I would recommend using this size. First off, you wanna be able to have an anchor point at the patient's leg. And you want to tell the patient to bring her toes towards her nose because you want the foot to be in a neutral position or a right angle. Show them what a neutral position is though. So it's kind of like a right angle right there because you don't want to point it down like this, because if you point it down like that, you can develop contractures or stiffness of your muscles, and you don't want that. You want to anchor the ACE wrap right about here on her lower leg. And you want to go the direction towards the other leg. So you want to go this way. And you don't want to overdo it super duper tight, because at the same time you don't want to impede blood flow, or you still want circulation. And then from here I'm gonna go down this way towards the inside of her foot. And I'm gonna apply a little bit more tensile strength. I'm gonna pull a little bit more because I want her ankle to go back the opposite way, the opposite of how she fell, because I don't wanna stress out the ligaments on the outside of her ankle. So from here, you feel the stretch though?
Yes.
Good. And from here, I'm gonna wrap around again back up top, forming a figure 8, and you just keep on going along the way. So I'm going to show you guys a closer look from here in this position. Same thing. So you want to be able to again anchor point right here, and you want to go the opposite. You want to go the direction of the other leg, and you want to do a figure 8 from here, and you want to pull the other way. You want to make sure to keep on telling the patient to bring her toes towards her nose, and you want to go the direction again of the opposite of how she fell, because you don't want to overstress those ligaments in the first few weeks or first few days of the injury, right, Zoe?
Yes.
I can't hear you, Zoe.
Yeah.
Good job. So you just want to keep on going. Again, a little bit snug here on the foot area, and not as tight here on the lower leg, because you still want blood flow. Again, guys, it's not rocket science. Just make sure she feels compression, it's comfortable, and it's not painful, right? Good job.
Yeah. So lastly, E for elevation. You can use like a pillow or a low stool to elevate your foot above your heart level, and you can do this 2-3 times a day for like 20 minutes, and this will reduce swelling as the blood again goes back to your heart to create blood flow.
I would recommend starting off with 20 minutes of leg elevation. Do it twice a day, and then you can progress to 30 minutes. If you have severe swelling, you can even progress to 30 minutes throughout the day if need be. Alright guys, thank you very much for watching this video with me today. If you like this video, make sure you smash the like button, subscribe, share this with your friends and family so they too can be pain-free. And if you want to follow my cousin Zoe on Instagram, what's your Instagram, Zoe?
I don't remember.
Yeah, it's going to be right there.
Yeah.
Click that, it's going to be right there. Yeah. That's her Instagram. And do you have any other socials?
No.
Snaps? Just IG?
Yeah.
But yeah, watch out for my cousin Zoe. She's going to have her YouTube channel soon. Good job today, Zoe. You did a good job.
Thank you.
For sure.
Yeah.
Peace. Price.